Cervical disc replacement is an advanced surgical procedure developed to address degenerative disc disease while maintaining neck mobility. In the cervical spine, bone segments safeguard the spinal cord, separated by cushioning discs for flexibility. As discs lose water due to age or disease, they shrink, reducing shock absorption and nerve passage space. Disc height loss can also spur bony growths, potentially compressing nerves and causing neck and arm pain. Retaining spinal mobility in young patients is crucial to avoid spinal disability. In the CDR procedure, two adjacent spinal discs are removed through the neck's front to address symptoms. After removal, the empty spaces are filled with cervical discs. In anterior cervical decompression and fusion, ACDF, a plate with screws is added for stability, while in the CDR procedure, motion at the treated levels is preserved. The goal of CDR is to alleviate arm pain and neurological symptoms resulting from damaged discs that irritate the spinal cord, myelopathy, and spinal nerve roots, radiculopathy. This is achieved by reducing stress on adjacent spinal levels. It also aims to avoid fusion of the spine, thereby preserving motion and neck movement. CDR is typically recommended for patients with healthy spinal bones, experiencing arm pain, weakness, numbness, or tingling due to damaged discs at adjacent levels C3 to C7. Surgery is recommended after unresponsive to non-surgical treatment, confirmed by diagnostic imaging. Recent studies suggest that cervical total disc replacement, TDR, can be a reasonable alternative to fusion due to potential complications of ACDF that are less common in CDR procedures. The advantages of CDR in comparison with ACDF at the 2-year mark post-surgery: 81.4% of patients with CDR achieved overall success, compared to 69.4% with ACDF. Patients with the CDR had better motion preservation, lower rates of severe complications, and fewer subsequent surgeries compared to those undergoing ACDF. Neurologic improvement was also observed in a higher percentage of CDR patients, with a quicker return to work than ACDF. In conclusion, cervical disc replacement is a valuable surgical option for patients which alleviate arm pain, prevents disc degeneration, and preserves cervical motion in younger patients. As compared to ACDF, it demonstrates better motion preservation, lower rates of severe complications, and a reduced need for subsequent surgeries.